Welcome to the DPO Club podcast, and we are happy to have with us Mr. Francis Polly, who represents the Narayana Health. He is also the head of privacy there at the Narayana Health. Polly comes with a lot of experience, primarily with respect to implementing privacy, especially in the BFSI sector earlier and now with the healthcare. He represents one of the most niche industries where the privacy is of vital importance in the healthcare sector. And we are here to discuss on the regime of DPDP implementation in the healthcare industries. Welcome, Mr. Francis Polly, and we hope to interact with you.
Thank you for having me. Uh, it's always a pleasure to talk to you, Binoj sir.
Thank you very much, Francis Polly, for giving us this opportunity. And you represent a very vital industry, where the inhibitions are very high with regard to how DPDP is going to impact the health industry per se, whether it be pharma, whether it be diagnostics, and you come from a very well-known industry of hospital as such. So I would like to ask you a very specific question with regard to, I know it is a little premature, but yet it is vital insofar as how can hospitals ensure that the patient's consent is obtained in a very clear, specific, and informed manner as deemed as demanded in the Act by virtue of the present law that is to be implemented by the hospitals in India.
Consent is not really new to the hospitals, right? There's already consent that is obtained for treatment, for inpatient kind of purposes. However, this brings in an additional consent that may be required to comply with the privacy. It is important, first of all, that we provide a disclosure in the form of a notice, right? What are we collecting? Why are we collecting? What kind of processing will happen? What kind of third party involvement is there for processing such data? It is very important that we are transparent, and that's what's required in the law. Obtain consent where necessary, right? See, the ideal or the intended purpose of collecting such data is to provide care. Anything apart from providing care, case in point marketing, for example, marketing of other products or other services will require consent. Where consent can be placed is there's always an onboarding process, and onboarding can happen through web, through an offline mode at hospitals. Uh, there's also some hospitals where you use kiosks, right? Those are the kind of entry points, and it's important that we obtain consent there. Basically, providing a checkbox, using a consent statement, making sure that the patient has had an opportunity to go through the privacy notice. There are challenges, of course, right? We operate in a country where there's a huge, urban-rural divide, education divide. For people who are unable to read and write, it will be tough, right? So we have to enable or empower our staff to help the customers, patients understand the notice, right? And why we are collecting the personal data that we are collecting. So again, there are requirements as per the DPDPA that consent should be free, informed, independent. Privacy notice needs to be independent of other policies. You cannot provide reference to other policies, internal policies of the organization. But if you really think about it, by being transparent and honest about how we are going to use personal data is going to set the standards for obtaining consent. Again, it's not just about obtaining consent. What we need to ensure is that after we obtain that consent, we use that data responsibly, and not go beyond the purposes that are mentioned in the notice. So we have a responsibility. Healthcare is a very critical sector, and people rely on industries, health industries, or health institutions like us, right, to make sure that while we provide care, we are also being responsible, secure, and secure their data. It's a huge responsibility, and I'm sure you know all the participants in the industry are thinking about it the same way.
You presently head the privacy venture of Narayana Health. It is but natural, and as per the law, all hospitals in India will become significant data producers. One of the challenges in those industries, while you are responsible to give healthcare or look after medical emergencies, you are also to imbibe the routine of the law and comply to major requirements by being a significant data producer. Now, one of the aspects is a DPIA, and hospital industry is so dynamic that every day something new would be added to your processes of. So hence there is a privacy angle at each and every angle. So there would be a continuous amount of effort or endeavor that will be done on the DPIA part.
Yeah.
So what do you think should the hospitals adhere to in terms of documentation to ensure that these DPIAs are done because of the fact that they are all high risk processing?
There's no question of not complying, right? I know you're doing a session sometime later on the gaps in the DPDPA, right? Significant data fiduciary or just a data fiduciary is a question that the industry has been asking, and a lot of people ask me if how an organization can be defined as a significant data fiduciary. But that will assume that because of the sensitivity and the volume of data that is being processed, the hospitals, at least the large ones, will become significant data fiduciary. I look at DPIAs from a risk management. I'm a risk management professional. I've done risk management for a few years now, almost a decade now. When I look at DPIAs, I look at risk management, right? In order to identify these risks, there's a bunch of questions, bunch of answers that needs to be provided through the DPIA or the impact assessment. While we complete those questions or respond to those questions, we identify high risks, right? Those high risks, it's just not the end of just identify it and forget it, right? There needs to be a risk management process built around identifying such risks, right? So most organizations have mature risk management processes where there is a process to build a risk register, then rate those risks, and then remediate such risks, and then there is a reporting built around or annual or frequent reporting built around reporting these risks, right? Once you identify high risk, right, it is important in the DPDPA too, right? There is a requirement for significant data fiduciaries to report these risks to the board, right? So that comes in, right? And in order for us to be able to demonstrate that we have that we have identified these high risks, and that may be a concern from data principal rights perspective, or uh, any other uh, reasons, right? We got to be able to demonstrate that we are doing something about it. Documentation becomes key. That risk management process becomes key. What have we done about it? Are we looking at alternative processes to achieve the same result, right? Which is less risky and less invasive when it comes to processing of personal data. So documenting it is very important, and keeping a record of such things when the regulator comes knocking is important to provide or demonstrate that we've done something about it, and we will continue to do something about it. Uh, all these are, risk management practices, right? Documentation is a key part of it, right? Of course, comments from the DPO or the CIO or the top management will also need to be recorded in order to provide evidence of it being worked on. So DPA is key. There's no getting away from it. The law clearly talks about conducting DPIAs, especially, and report high risks to the board. So
Yeah, I know you've
important.
talked quite academic in that
Yeah.
sense. I now shift my focus from a more academic regime to the patient per se.
Mm.
Now, let's say you have already said that I need to serve the notice and then take the consent before a patient is operated upon or a patient is, managed upon. There's one old woman who, say, 70-year-old, she comes and says, Gutila, what will you do in that aspect? And how will you impose privacy and the rights of privacy on that person?
Yeah, so responsible organizations would have started working on.
Yeah, by the way, Gutila in privacy means I don't know. I don't know. Yeah.
I understand.
Yeah.
So see, I understand that. So I'm just saying that we are in the early stages of implementation of these laws, right? There's a lot of gaps in terms of awareness, in terms of training. The public, general public, may not be aware of what rights they have, right? It is important that as an industry, and I'm not talking about just the healthcare industry, the whole setup across industries. The first focus should be on educating the general citizens about such rights. As of now, I think that is missing, but we'll get there, right? But if such things come up, right? Let's say somebody's requesting such rights, it is the organization's responsibility to build in mechanisms to support the processing of such requests, right? And you have to make it easy. You cannot have processes in place which or creates loops or hoops to for the customer to request for such rights. Again, you got to be transparent, uh, ethical in the use of the patient's personal data, and all those mechanisms that you build. I know it cannot be perfect, right? So um, it is easy to say provide the same kind of provision for revoking consent versus providing consent. Practically, how that can be incorporated may be a question for every organization to ask, but it should be relatively easy, uh, or should be made relatively easy. uh, we know of a lot of these shopping websites which make it difficult for you to be able to close an account versus opening an account, right? It should not be that difficult, right?
Okay.
So my view here is that one, the education, people need to know their rights, right? And again, that can be done uh, through the notice, through programs, through awareness. There's also this language, 22 languages, which has to be ensured, right? The notices, the consent statements could be, has to be in these languages. So someone
Yeah.
coming up and asking or telling Gotila will have to be responded to in through the notice in Kannada, for example.
Okay. Let me give you a challenge here. A large amount of population in India understand the physical language, but they don't know how to write or read the language. So in that case, how will you adhere to the timelines or the flow of consent, notice, and
So, in India, that is a big challenge, right? And this is something that I've spoken about in detail with, especially where I was working before with a big bank, right? These guys have branches in the most remotest areas. They have one-man branches, in some areas. So the question would be, how do we even serve notice, right? And how do you ensure that the customer coming in understands, what we are trying to tell them, right? Um, I've spoken with a lot of these tool providers, and one of the things that I thought was very interesting was you can actually, with today's technological uh, improvements, right? You can actually read out these notices, right? That would solve some of the problems. Again,
yeah,
it does not really solve all the problems, but I think some of that clarity uh, will come in when you
true.
hear such
Of course, as
a notice.
implementation goes in, there's a lot of water to flow down
Yes.
the river. Yeah. Now coming back to the human resource in a hospital. Recently, I did conduct a small workshop on privacy for some AIMS doctor. And I was surprised that all my audience were actually, PG doctors. So the first inhibition they had was, so we are supposed to provide, services in terms of healthcare, and you're making us responsible for privacy also in our hospital. Maybe a registrar or a hospital management authority may have access to such legal background and things. But doctors are so busy that they are always, involved in the routine aspects and forget about these compliance and regulatory requirements. So, in your organization, how do you propose to, train these nurses, doctors, those who are not part of the management aspect of privacy in this journey of implementing the DPDP law?
Yep. So I'll talk about healthcare as a whole, right? The frontline staff, when you say doctors and nurses, play a very important role, right? They are speaking with patients. They are collecting data from the patients. The admin staff also, right? They are also part of the frontline staff, right? Um, Staff awareness is of key importance. Continuous trainings, awareness, uh, kind of interventions are really key to making this a success. Um, there could be classroom trainings or in person or web trainings, right? So those needs to be addressed, and those needs to be done in frequent intervals so that by the time this law becomes effective, right, they understand the seriousness of these compliances. We have to tell them, we have to let them know, okay, this data is what is required to be collected, nothing beyond that. Data minimization principle, right? Uh, they need to be made aware of the data principal rights, right? Because most of the time it will be them who will have to receive such requests, right? And how do you process that? How do you get those requests to the compliance team, to the privacy team, to kind of the right and follow the right processes, right? It is an intensive effort, continuous effort that needs to be put in. That can be done through these interventions. There could be, privacy week or privacy day. Those kind of interventions can also work. What can also work is somebody at the unit helping, them understand. So, ideally, how hospitals function is there is someone, assigned who takes care of IT or compliances at the units at the hospitals itself, right? Training them and then helping them understand the concept, train the trainer kind of a model, because you cannot be present everywhere across the country or across the world, right? It's important for them to understand it first and then deliver that to the frontline staff. It is difficult, right? It is not easy to drive that message down. What is also helpful is if you have top management sold to the idea of having a privacy program, right? Which is easy because of the amounts of fines, right? That the DPDPA imposes.
Touched upon a very vital aspect. Yeah.
Correct. So if the top management is sold, they will support this kind of a program, right? So first thing, sell the top management that we need a privacy program so that we don't have those risks, financial, reputational, etc. And then training the staff or the person available at these hospitals so that they can act as a trainer for this for the local staff. So those 2-3 steps becomes very important.
Okay. Right. As I was speaking to you, I was actually daydreaming on one aspect. A DPO is going to be a permanent, incumbent and a job, I say. So what came to my mind was suddenly a DPO with a stethoscope on his neck. How do you visualize this in the hospital?
Yeah, it's a very tough question to answer, right? See, in a sense, if you look at the requirements of a DPO, right?
I don't mean any bad to a doctor.
No, I understand. So, see, the doctors and the nurses already comply with a lot of requirements, right? And this is just, or I could consider that this is just one of them.
I'm talking about a designation of a DPO in a hospital with a stethoscope on his neck.
So people have to play their own roles, right?
Because the doctor understands privacy better in an hospital than probably what a non-doctor.
And it'll be helpful if they understand it better than a DPO, right? But yeah, I mean, that would be very helpful. But again, some amount of intervention will absolutely help.
Francis Polly, as a person, I have known you. You migrated from a banking sector or the economics sector to a healthcare to actually take the journey of Narayana forward in terms of privacy. What do you think the organization, I mean, specific to hospitals, need to restructure their hierarchy and their designations and their offices within to accommodate this DPDP law in hospital?
So see, there are traditional models or hierarchies that are already built in an industry like banking. The compliances are taken very seriously there. They've already built those structures in, right? They call it compliance management system, lines of defense, whatever you call it, right? They have those systems built in. While healthcare is not as regulated as banking, right? What is important to know is that, at least in my opinion, there are 3 levels of structures that can be built to ensure that DPDPA or privacy compliances are managed, are adhered to, right? The first is the governance bit, right, or the strategy bit, right? The board, the top management, right? They need to understand that okay, this is required, this is what needs to be done, and provide resources accordingly.
Especially when the volume of fines are huge.
Especially when the volume of fines are huge. The other bit is this in the strategy, in the structure under strategy, the DPO also plays a role, right? And then there is the legal counsel, right? A lot of support needs to come from there. How privacy notices needs to be make sure that these are legally vetted. So you'll have to sell this program to not only the top management. I mean, top management could include the GC or the top legal official in the organization. But if not, they also need to provide their support, or will need to seek their support. The other is the operational. How is a privacy program going to run, right? Uh, the head of information security or the CISO plays a role in terms of making sure that there are technical safeguards in place. Those are the requirements. These are the requirements. These are technical requirements of the DPDPA, and these have to be in place, audited, checked, verified, etc. And then there are people who need to manage the consent management bit. There are also this operational layer of people who will need to manage these data principal rights, right? So that's the operational level people. It could also include people, legal people, right, who go through these, DPAs with vendors, third parties, etc. And the last bit, we already talked about it, is the frontline staff, right? Are we providing enough support to help them understand these nuances, these requirements? Are we providing staff training, awareness? Is there awareness programs that are built into these? You could seek the support of the HR or the L&D, learning and development teams, to provide such training, help with such interventions. And then, there's also this vendor ecosystem, right? Uh, it's not really, you would not call it frontline, but I would include them also. How are they audited? How are the assurances that they have provided us through the MSA, through the DPA being fulfilled? Some amount of checks will need to be in place. So three levels basically: governance, operational, and then the frontline staff. Three levels needs to be built. We could have uh, champions, across departments, who can help the privacy team understand the processes. If there are any changes, if there are new, processing that cuts across the purposes that we've already mentioned in our notices, that awareness needs to be provided to the privacy team. In the end, there's a saying in compliance that every employee is responsible for compliance. It's not just the privacy or the compliance team or the legal team who needs to be responsible.
Absolutely. You touched upon an aspect of reasonable security safeguard, which is enshrined in Section 7 and 8 of the Act per se. Now, this is quite vital and it cannot be absorbed even from the hospitality industry, though you claim that we only are in healthcare. So, how do you think that the IT team need to align and assist the privacy journey of in a hospital? An IT team is actually one of the smallest of departments in the hospital, and it's not given that significance. So, what do you think should be the golden word for the IT team in hospital?
Yeah, the IT team will love it when I say that they'll need to be empowered. Right?
Yeah, I like that.
And provided enough resources.
Absolutely.
Right. See, privacy cannot exist without security. Right.
Probably as much you would invest or budget for a CT scan machine, that much should be the vitality in which you should look at the IT team.
Yes, and the IT teams would love to hear all this. Right? With these requirements coming in, right? The IT team will get some visibility, because the DPDPA rules, right, clearly call out some requirements that are proposed, suggested, right? It is increasingly becoming important that there's enough pressures to make sure that the IT team gets these resources, gets the visibility, gets the finances to put this in place. Privacy is, or the DPDPA is just a enabler, right? In the end, healthcare data is highly sought after, right? It's at high risk, right? Probably healthcare data and banking data is the most attacked, in my opinion, right? And there's some, data around it also, right? So it is becoming increasingly important that we pay attention to security requirements and privacy requirements. Privacy requirements is just a subset of these security requirements.
And thank you very much. And a word of caution here, that if you lack on reasonable security safeguard, irrespective, you may be a hospital, the fine is 200
Yes.
crores. So thank you very much, Polly, for coming over and spending time with us here. And I hope this podcast reaches each and every hospital in India, because you've given such vital aspects that is cannot be avoided by the hospitals too in India. Thank you very much.
Thank you for the opportunity.